So good day to everybody. To welcome you to this session. This is the topic of this session is engaging with faith communities during health emergencies. My name is Sarah Hess, and I work in the Health Emergencies Program at WHO in headquarters in Geneva. And I'm very pleased to be presenting on some of the work that we're doing together with Sally and Alex. I'm going to hand to Sally now to introduce herself and then over to Alex.
Hi everyone, my name is Sally Smith. I'm a consultant working alongside Sarah in the World Health Organization in Geneva on engaging with faith communities in health emergencies.
Hi everyone, my name is Alex McFedrin and I'm also a consultant supporting Sarah and Sally on this work engaging faith communities.
Wonderful. So today we're going to take you through some of the challenges that we have experienced during the COVID-19 pandemic that are of particular interest as we look at engagement and collaboration with different communities, and more specifically with faith communities, as is the subject of this presentation today. So one of the most important that everybody knows, we don't have to dwell too much on it, is the fact that this pandemic, the longer it goes on, the more significant and long-lasting the economic and social impacts of the pandemic. There are some statistics on the screen here today that you can see that are taken from a report done by the World Bank Group that estimated a 4% contraction of GDP in 2020. They also estimated through their modeling and research that up to 115 million people would be driven into extreme poverty due to this crisis. One of the greatest impacts of the pandemic has been on the world of work, so the employment sector. And another one of their estimates was that 9% of global working hours were lost in 2020. So these are very significant impacts, and they mean that those that are most vulnerable or already vulnerable are increasingly at risk, let alone folks and communities that were not vulnerable before, but are now experiencing increasing vulnerability. So when we talk about vulnerable and affected communities, we've seen that informal workers have been severely impacted. Often they fall outside of social protection measures within countries. We know that people who are living in closed settings have also been at greater risk of outbreaks and also not able to access good care as easily. We have many existing humanitarian emergencies around the world, and people within these settings, often migrant communities, communities where there are conflict, are experiencing increasing vulnerabilities. Older adults, as we know, were at risk of more severe disease. Young people and students have been impacted with the disruptions to educations. Healthcare workers, we've heard a lot about healthcare workers, how they've been exposed to violence in the workplace, how they've not been able to access personal protective equipment and have been at increased risk of contracting COVID-19. I mentioned briefly the refugees and migrants. This is a huge community that requires concerted efforts and attention. And then another really worrying aspect of this community is those that survive and did not survive gender-based violence. With the lockdowns around the world, we saw a huge increase in gender-based violence, and not to mention the impacts on these communities' mental health and well-being. Another issue that we're experiences the inequitable access to vaccines. There are limited supplies, and so WHO really, in order to optimize the public health impact of vaccination, recommends prioritization. And so WHO recommends that risk groups be vaccinated first, such as older adults and persons with underlying conditions and the health workforce. And the objectives of this prioritization is to really reduce the severe cases among the population and to relieve the pressure on healthcare settings. However, unfortunately, we're not seeing this happening in many settings in the world. Many high-income countries are vaccinating more than just at-risk groups. They're vaccinating entire populations, while other countries don't have access to vaccines for their at-risk groups. And this is a big concern globally. Another issue that has been very apparent since the beginning of the pandemic is the need for clear, transparent, timely communication, particularly with all the uncertainty that has been around. We know that health authorities and leaders have really been grappling with how to acknowledge this uncertainty and still maintain the trust of the public. We've also seen a huge rise in misinformation. And so how to counter this information has been a very important part of the pandemic response. We've also seen very clearly the role of trusted influencers in this space of communication, and how existing trusted influencers with their networks are continuing to play that role of trusted sources of information. And so with this context and background, I'm going to hand over to Sally now, who's going to take us through some faith-specific considerations of why we are working with faith communities during this pandemic. Over to you, Sally.
Thanks very much, Sarah. And I think it's not just why we should work with faith communities, it's why we should not. There are 5.8 billion people in the world who recognize some kind of or follow some kind of religious faith. And therefore, it's a given that we need to engage with people of faith and work with religious communities. They were there first. They are very embedded in societies. And I think one of the things that we've seen in our work over many years is that the secularist bias within perhaps the Western Northern Hemisphere is not represented in the rest of the world. And the secularist bias within science and within the diplomatic and diplomatic community and in our work is not represented elsewhere. Many of the universities and many of the schools and the hospitals were set up by religious groups many years ago and are still going today. And there's a very strong collaboration in many countries between faith leadership and religious leadership and national leadership, especially in running the infrastructure of the country. So that dichotomy, I think I would want to say, is a false dichotomy. And the report by the Pew Foundation from 2012 is one of the gold standard reports that many would look to, that has done a serious piece of demographic study in more than 230 countries to establish the number of people who would identify as associating with a religious group of some kind. And many of these faith traditions are integrally connected with local communities. They're not only local, they're also district-wide, regional, national, and global. Many of them have, as I mentioned before, health infrastructure, academic universities and schools, but also communication networks. And so these information transmission systems are there. And these groups have been working with communities for many years to help them prepare for emergencies, to help them to respond to famines and disasters, to help to treat the sick. And the values within the faith communities are very much about reaching out to one's neighbour, reaching out to care for the sick, the poor, the marginalised. And the values are integral to faith communities to look after those who are the alien and the foreigner in the land, those who are migrants and refugees. And so many of these communities have already been working on with these issues for generations and have long communities of trust within the areas in which they work. The next slide, please. So I've already mentioned a little bit about some of the things that faith communities do in their integral part of communities. They are an integral part of emergency preparedness and response. And some of that work is just part of who they are and the infrastructure that they are and they provide. Other parts are actually intentional and have been planned, developed, and integrated into local community outreach. They provide spiritual support and services to communities, including in leading and providing opportunities for worship and as many houses of worship have had to be closed during a pandemic like this, they've found new and creative ways to develop the provision of social services online. They accompany people through the important stages of life, through birth, death, marriage, and funeral and grief processes. And in all of those stages, they provide pastoral care and also local support. I remember when we were working in Nepal, when someone died in the community, people from the village would go and someone would sit with them day and night for the whole week, that they weren't left alone. Some of these community caring systems are both integral to faith and community. And they provide a sense of meaning and purpose, a purpose in life, and provide people with a future and a hope. They increase social cohesion and they build resilience, if we talk about the kinds of words that we would use in disaster preparedness and management of outbreaks. But that really means that local community network where people know each other, they look out for each other. Some of these faith actors have actually deliberately and intentionally strengthened those networks and built resistance. We have some examples of communities that worked after the tsunami, for example, to train communities to identify and have a list of those in their area who were particularly vulnerable, so that if there was another tsunami, and now in the context of the pandemic, they would know which house to go to and who to support, ask if they had food, were they safe, did they need any help? And so these cohesive mechanisms and resilience mechanisms have been activated and strengthened by the faith communities, particularly in advance of and through this pandemic. They promote mental health and combat social stigma, caring for the most vulnerable. We have to admit that sometimes the faith community exaggerate the stigma, and those who are not seen to fit within some of the religious communities can be the target of stigma and religious stigma. And that's something we faced in the HIV response. So it's important to work with faith communities to help them to put forward all of their values and not exclude. They have great communication channels. Which other kind of community has a captive audience of people in their within their village every week to listen to a sermon? They have radio channels and television channels. They have books and pamphlets and newspapers. And so just a very effective communication system. And as I've mentioned before, they deliver health, education, and community development services across much of the world. And many of them most recently have shared their buildings as community centres to offer critical services and shelter, both in a tsunami, in a pandemic, in an earthquake, and now to offer vaccines. Maybe we could go to the next slide. Thank you. So WHO is supporting the work of faith leaders, faith-based organisations, partners and faith communities. And I should mention that this particular team that's presenting today is the global team. We have colleagues working at a regional and at a national level, and in some countries, larger countries, also at a regional and district level within those countries. And we work with the networks of religious communities and faith-based organisations that have global, regional, national and district and local presence. And it's important, I think, to say that some of the work we do at the global level has an implication for everyone. We can set some overarching guidelines and targets, but a lot of the work is important at a national and a local district level, where the nuances and the differences are very important. And that's where it's critical that our colleagues working at a national level are able to speak national languages. And we've worked also with others who've been able to translate much of the information into local languages. So what we've been doing is to gather and share good practices and experiences. We've been able to connect some of the faith communities from different religious traditions and across different geographic regions so that they can learn from one another and exchange examples. Together, we've developed guidance, practical considerations and recommendations for religious leaders and faith communities in the context of COVID. And I think one important thing to say here is that it is respectful of religious freedom to enable religious communities to find different ways to practice their religion safely in the context of an epidemic. And so closing your house of worship is not an act of restricting your religious freedom. It's enabling you to find another way to exercise your faith in a way that's not going to endanger life. And I think it's important as we talk about these things to say that part of this work is to help faith communities to do that themselves, and to take on the scientific principles and adapt them to their own religious tradition and community and values and needs. We've also provided briefings to different groups. We've brought in technical experts, for example, to brief them on the pandemic itself and on the vaccine development, for example, and connect across different faith and other communities. And finally, we've been able to develop some advocacy initiatives together that will support equity and access to essential services. And some of these communities have gone ahead and taken up that advocacy at a national level and called for services to be made available, for example, to refugees and migrants and those who are stateless within the country. I think we're on to the next slide. Thank you. And that, with that, I'll hand it to Alex.
Sorry. So I think, as Sally's mentioned, faith actors play a huge role always in lives in many, many people around the world, but specifically in this pandemic, with the backdrop of the epidemic, they've become incredibly important in sharing information. So as we know, the infodemic has complex aspects to our response. And one of these things is to provide information that is respectful of scientific evidence, but also religious values. So here's where faith actors are able to contextualize and tailor information so that constituents of particular religions and faiths can use this in a way that supports their way of life, but also it provides safety and security as we respond to the pandemic. For example, in the pictures below, you see love your neighbor is a way of contributing a tenet of faith to also the protective measures such as wearing a mask or social distancing that are important for keeping the transmission very low during this time. Faith actors play a very important role in listening and responding to concerns, rumors, and myths in their communities. In this way, there's an aspect of social listening and a feedback loop where WHO is able to learn what is going on in communities and what are the main concerns, and then we're able to respond with accurate information. Faith actors then tailor this information. It might be in languages, it might be within the religious values and so forth, so that this is, really well understood by communities going forward. For example, in the middle here, we have this myth, and there's a big Mythbuster series that WHO did. But what was important was understanding, well, what myths and concerns are the faith communities hearing themselves? This one in particular is about the aborted fetal cells. And here we have an understanding of what's actually in the vaccines, which was very important for people in terms of their uptake and their confidence in vaccines. So addressing these things head on is really important, and faith actors are trusted sources of information that therefore can share this in a way that is understood and appreciated and different from WHO. And in the picture on the left, or on the right, sorry, we have a way of, as Sally has said, if we're able to open up our places of worship, doing it safely. So this goes back to the guidance which WHO has worked a lot on with our faith partners in terms of how can we continue life in a way that's important and meaningful to everyone, but also done safely. So there's a number of different ways that faith actors are helping to manage the infodemic and addressing sharing positive and correct information, but also in a way that is defined by the way of life that people have within their faiths. Next slide, Sarah. So faith leaders play a huge role in engaging their constituents. And one way that they've done that is through faith leaders themselves receiving the vaccine. And we've seen faith leaders from all over the world sharing that on social media or through their newsletters, or even in their place of worship if vaccination's held there. And this is an incredible way for people to gain confidence in the vaccine, but also to be able to discuss this with someone that they trust. So that's been really, really useful for many people around the world to see. A huge thing that has happened is that many faith-based organizations have issued statements. For instance, the Pope has issued multiple statements and made several recommendations for vaccine equity, access, and uptake. And this has even evolved into him setting up a commission and developing a toolkit which can be used by faith leaders around the world. And as we know, there's many people, as Sally has pointed out, that follow faith around the world. So these statements reach a vast number of people. And what's important about these statements is that they address concerns and issues and values that maybe perhaps we ourselves wouldn't take upon as like a scientific body. So this has been very important in terms of it being faith specific. We've also seen different guidance put out around with Ramadan and around Eid, and this has been developed largely in part with our Eastern Mediterranean EMRO office, the regional office. And this has been useful for not only the value of vaccination and the questions and answers around it, but what can be done during certain rituals and certain faith celebrations which has been really, really critical. We've also seen different religions, such as the Jewish community has done certain prayers around vaccination. So there's a lot of different examples where this has been tailored. And then there's also interreligious statements as well, put out by Religions for Peace and such. Another great aspect of this work has been that places of worship have been used for vaccine delivery, as mentioned. Sorry, Sarah. And as on the right, we have the Salisbury Cathedral in the UK. And we've seen this happen in mosques and temples. And this isn't new. Always in history, we've seen places of worship be a place of refuge, often in disasters and crises. And it's incredible to see these spaces used as a safe place for people to come during this time for vaccination. So next slide. As mentioned by both Sarah and Sally, there's a lot of important work being done around vaccine equity. And in March of this year, we had the WHO DG, Tedros, speak at a high-level roundtable with global religious leaders, about 20 different leaders, which was convened by Religions for Peace. This kind of set a tone for vaccine equity and access and the role that faith actors play in this arena. Since then, we've had a number of different briefings and working on different webinars with faith actors. So this technical briefing that's listed here in May helped to bring together technical experts outside of WHO and within WHO and faith actors to provide correct information and kind of a landscape analysis of what's going on. So the faith actors are then equipped to take forward their advocacy work because they're already very engaged. It's about sharing information so they can take that forward. We're also working with WHO, or we are WHO, UNICEF and Religions for Peace to convene global webinars on the role and impact of faith actors in advocating for equitable access to COVID vaccines. So this has been already is undergoing, and you can find some of these recordings on EPI-WIN's YouTube channel, and they're continuing as well. And we have a great multi-faith panel who then also show us and demonstrate the lessons learned specific to different religions around the world. Lastly, of course, we've developed messaging together. So this is where we try to align the scientific and evidence-based with the religious values and have respect for both. All of these statements here, as some were mentioned before, from the Pope, from Religions for Peace, the Anglican Alliance, and Faith for Vaccines. So that's another example of interreligious statements put forward that bring together different faiths around the world in a shared value of vaccine equity and uptake. Over to you, Sarah.
Thanks very much, Alex. So you can see that while we sit within the infodemic management, risk communication, community engagement pillar of the COVID-19 pandemic response within WHO, our work with faith communities is much broader than that, because it's really a critical part of our work is building these relationships of trust that are mutually beneficial, not just to WHO, but to the constituents that we serve and to our member states. And anyway, so to take this work forward with faith communities in 2021, what we have done is we have convened 3 communities of practice. And these communities of practice include representatives from diverse faith traditions, from including faith leaders and faith-based organizations, local faith communities. And we have asked people to volunteer to be on these communities of practice to take forward these 3 areas of work. The first area of work is really about facilitating communication around the COVID-19 vaccines. And this goes back to one of those challenges that we referred to early on in the presentation about the need for transparent, trustworthy, accurate, timely information based on the scientific evidence. So what we're doing, and Alex mentioned it in her part of the presentation, is co-develop simplified messages, build a repository of trusted resources, and consolidate some of the advocacy work that is going on around the vaccines around the world. The second community of practice is working together to co-develop a WHO strategy for engaging faith partners. And this strategy is to strengthen and institutionalize the engagement across health emergencies. And within this strategy, there will be different areas of work, including infodemic management, risk communication, and community engagement. The third community of practice is looking at some gaps in the research and some capacity building and training needs. And we have identified several areas to take forward over the course of the year, and those areas are spiritual care, palliative care, and looking into historical medical racism and how that's impacting the pandemic and vaccination uptake in the COVID-19 response. And so these three communities of practice are going to feed into a faith conference that we will be hosting in the third quarter of this year. And we look forward. We have a very inclusive policy, of course, and if anybody is interested in being a part of this journey and a part of this work, we have included on the slides our contact details here. If you have any questions, of course, please do not hesitate to reach out to us. And it's really been a pleasure, and I'm sure I can speak on behalf of Sally and Alex as well, to present a little bit on our work today. So thank you for taking the time to listen in and watch this recording. And it's goodbye from me, Sally, Alex.
Bye.
Thanks so much.
Wonderful. Thank you very much.